Hey,
Hi.
I'm Shelby. I'm your nurse today. I'm going to do a little assessment on you.
Okay.
Okay? So my patient here looks good, dressed well, no odors. She is, seems to be, her facial expressions are appropriate for the situation. No signs of distress are noted. Breathing smoothly, normal. Her skin is normal for her ethnicity. Build is normal. Her height is normal. Posture is upright. And her appearance is just all around looks good. No odors or anything. Speech is normal. Hair is thick and long, evenly distributed over her head, blonde and smooth. Her nails are smooth, thick. There's no lesions or open sores anywhere on her nails, and there's no clubbing that's noted. They're rounded, and the nail beds appear to be normal. And your hair, we talked about your hair, and your, do you mind if I touch your head?
That's okay.
I'm going to put some gloves on. Okay. So I'm just going to be checking for any abnormalities on your head, okay? Tell me if it hurts. Does that hurt?
No.
Okay, I don't feel any lesions. I don't feel any bumps. It's smooth. No tenderness. Okay. Now I'm just going to feel for your lymph nodes. I shouldn't feel anything, so that'll be normal. You tell me if you feel any pain, tenderness, or anything like that, okay? So I'm going to start back here. Okay, I'm going to move back here to behind your ears. Okay, now I'm going to come down here. I'm going to come right here. Under your chin. Come around here. Here. And here. And I don't feel anything. There's no pain or anything. Okay, good. So we're going to do the Snellen chart later at the very end of the assessment, okay? We'll walk outside. It's on the outside of the door, so we'll do that last. Now we're just going to do a little test where you're going to cover your eye, and I'm going to cover the same eye. We're going to test your visual fields and your peripheries, okay? So just cover your eye, and I'm going to cover my eye, and I'm going to bring my hand out here, and you tell me when you see it.
Now.
Okay?
Now.
Okay.
Now. Now.
Okay, good. Now we're going to do the other eye. All right, you ready?
Mm-hmm. Now.
Okay.
Now.
Good.
Now.
Good.
Now.
Okay. So you've got normal vision in your peripherals. Now I'm going to do your extraocular movement. So you're just going to look at my finger, and you're going to follow it. You're not going to move your head, okay? Good. Good. Down here. Down here. Good. So now I'm going to shine a pin light in your eye, and I'm going to check your midline corneal reflection, okay? So you just look at me, and I'm just going to make sure this light is in the middle of your pupils on either side, okay? All right, so they're in the middle, they're equal bilaterally. Now I'm going to check convergence, and that's just whenever you watch my finger, you just watch it come to your nose, okay? Good, convergence is good. Now I'm just going to take a look at your eyes. They're equal, symmetric, no lesions, no rashes. Eyebrows are even, evenly distributed. The hair is. Eyelashes are evenly distributed, equal on either side. And eyelids are appropriate for ethnicity, the color of them. And I'm just going to kind of look inside your eye a little bit. And I've got my ophthalmoscope here that I'm going to use. Just kind of look at me, and I'm just going to kind of look on the outside. Your sclera is white and clear. There are little vessels I see, and your conjunctiva moist and pink. No abnormalities, no discolorations. Okay, your cornea and your lens look to be clear. Now I'm going to check your pupils first before I get my ophthalmoscope. So just look straight ahead for me, and I'm just going to shine this in to make sure your pupils are equal. Pupils are equal, round, reactive to light, and accommodation. Now I'm going to use my ophthalmoscope here. I'm going to turn the light out. Is that okay?
That's okay.
Okay. So just look ahead for me, and I'm going to come in at an angle, and I'm going to look inside your pupil into the back of your eye, okay? I'm going to come close to you too, so don't be alarmed. All right, I see your red reflex, and as I get closer, I'm going to find a vessel and follow it in, and I see it. And that leads me to the optic disc. I also see your macular area. It's a little bit darker than your retina, and it's clear. I don't see any abnormal color in there. So we're good on that. I'm going to come over here and do this one. Same thing. Okay, I see your red reflex is right there, and I see a vessel. I'm going to follow it in to your optic nerve, your optic disc. And your macular area, I see it. It's darker than your retina, and it's clear, and okay. So we're good there. I'm going to turn the light back on. Okay. There we go. I'm going to palpate your lacrimal apparatus down here, okay? You tell me if there's any pain or tenderness. You good? Mm-hmm. All right, now, so clench your teeth for me. I'm going to feel your temporal and masseter muscles. They're strong, equal bilaterally. Now you raise your eyebrows for me. Okay, close your eyes. Pucker your lips out. Smile. Clench your teeth. Puff your lips out. Puff your cheeks out. Good. Now I'm going to percuss on your sinuses. So I'm going to do a little tap, okay? Tell me if you're feeling pain while I'm doing it. Okay? No pain? Okay, no tenderness or anything. It sounds equal bilaterally. I'm also going to palpate them too. Okay. All right, so now we're going to do range of motion of your neck. Can you bend down? Good. And back, and side, to side. Okay, now I'm going to palpate your muscles here on your neck. They're soft, firm, no masses. Is that painful? Tender? Nope. All right, now you're going to shrug your shoulders for me against my hands, okay? Okay. Okay, good. Equal bilaterally. Now I'm going to auscultate your carotid arteries. Just relax. All right, I don't hear a thrill or a bruit. And now I'm going to palpate your thyroid from the front and from the back. So I'm just going to put my hands right here, and I'm going to move your thyroid over with this hand and feel on this side. Swallow for me. Okay, good. Now I'm going to move it over this way. Swallow again. Good. I don't feel any of your thyroid gland, and that's normal. So I'm going to come back here and do it the same way, okay? All right, swallow for me. Good. Swallow. Good. All right, I can't feel your thyroid. Now I'm going to do your ears. Okay. I'm going to check your tragus here on either side. They feel the same on either side. And with my otoscope here, I'm going to look into your ear canal, and then I'm going to look at your tympanic membrane on either side. Okay?
All right.
You pull your ear up and take a look. I see some earwax and some hair, but no foreign objects or anything like that. All right, I'm going to stick it in a little bit. All right, your tympanic membrane is translucent and pearly gray color. I don't see any holes or anything in there. Still very good. You can check the other side. Okay, I don't see any foreign objects. I see a little bit of earwax and some hair. And then stick it in a little more on your tympanic membrane. It's also translucent over here and pearly white, gray pearly white, and no holes or anything. Okay. Now I'm going to use this tuning fork. This is just to test your hearing. I'm going to whack it and make it make a noise. I'm going to stick it on the top of your head, and you just tell me if you can hear it equally on both sides, okay?
Equal.
Equal, okay. Now what I'm going to do is check bone conduction and air conduction. I'm going to tap it, and I'm going to put my watch on so that I can time it. Okay. So you're just gonna listen. I'm gonna tap it like I did just a second ago. I'm gonna put it back here, and you tell me when you stop hearing it. And then I'm gonna put it right here, and then you tell me when you stop hearing it, okay? All right. So overall, it was 27 seconds. It was 7 here, and what is it? 20. 20 in the front of your ear. So we'll do the same thing over here on this side.
No? No.
Okay. So it was 8 behind here, and then it was 16 in the front. So 24 altogether. Okay. Now I'm going to inspect your nose. Just relax for me. Looks like you've got pink mucous membranes, and the turbinates are a little bit darker, and then your septum is midline, straight, and there's no tears on it or holes or anything like that. Now we're gonna now you're gonna name the smell that I put in front of your nose. So I'm gonna have you close your eyes. You're gonna cover one nose, and you're gonna smell. You're gonna tell me what it is, and then we'll cover the other nose, and I'll have a completely different smell. Okay?
Okay.
All right. All right.
Coffee.
Yeah. Good job. Okay, ready?
Peppermint.
Yep, that's right. Okay, so now I'm just going to inspect your mouth. Well, I'm going to do your lips first. Lips are pink, moist, and have the vertical lines on them. And open your mouth for me. Buccal mucosa is pink, moist, free of lesions or tears or anything like that. Teeth are white, straight, not chipped. I see a few fillings in the back. And let me look down here. Your teeth are anchored by your gums. Nothing's broken, evenly spaced, correct alignment. Oh, let me look at the roof of your mouth. Intact with some rugae noted, and the corner of your mouth is intact as well. I'm just going to use, can you have me a paper towel? Thank you. I'm just going to feel the texture of your tongue with this 4x4 here that I just made. Now, stick your tongue out for me. Okay, it feels good, firm. Is that tender or sore? All right, good. Okay, now, stick your tongue out for me and say, ah.
Ah.
Okay, I'm going to make a gag, okay? Okay, good. Your gag reflex is intact. Okay. Now we're going to do the thorax and lung assessment. I'm just going to assess how you breathe, how your chest feels, see if there's any abnormalities there. So I'm just going to place my hands right here and you take a deep breath for me. Okay, do it again. Good, so you have symmetric respiratory movement and your chest expands the same bilaterally. Now I'm going to place my hands on the middle of your back, and I want you to take, I'm sorry, you're sitting on your gown. All right, take a deep breath for me. I'm going to watch the way my fingers move. Okay, one more time. Good. Got breath sounds that are, or breath movements that's equal on either side. Now I'm going to check your tactile firmitas. So if you'll just kind of turn your legs that way for me. And I'm going to get you to say, I'm going to check the vibrations of your back and your chest. So whenever I place my hands and move them, you're going to say 99, okay? All right, go.
99, 99, 99, 99, 99.
All right, vibrations are heard bilaterally. And now I'm going to check your spine. Is that tender?
No. Okay.
Okay, it's straight. The scapula are symmetric, and your musculature is well developed. Any soreness or anything like that?
No.
Okay, now I'm going to percuss your lung sites. Back here, the 8 sites. So you just breathe normally, okay? good deal. Now I'm going to test your diaphragmatic excursion. What I'm going to do is have you take a big deep breath and hold it until I tell you to let go. Okay, and then I'm going to draw a mark on your back, okay?
Okay.
So, big deep breath for me. Okay. I'm just going to draw a little mark right here. Now, you're going to do the same thing except you're going to exhale and then hold your breath.
Okay.
Tell me when you're ready. Okay. All right, you're good. You can let go. All right, now I'm going to measure that. And it is 4 centimeters. Your diaphragmatic excursion is 4 centimeters.
Okay.
Now I'm going to auscultate your breath sounds in the same area that I percussed them with my stethoscope. Take a deep breath for me. Good. Again. Okay. Again. 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 And one more time. All right, good deal. All right, now I'm going to have you lie back on your back for me. I'm not going to do a breast exam on you today, but I'm going to teach you how to do one. Okay? So you're going to do this monthly to check for anything that's abnormal that could indicate that you have some kind of breast cancer or something like that, and we want to get that before it gets too far along. So what you're going to do is you're going to take a look at your breasts in the mirror to make sure that they're symmetric, that they're equal, that they're the same shape, the same size, and that they're smooth, no lesions, no anything that just sticks out to you just by looking at them. Then you're going to look at your nipples and your areola. The areola should be a little bit darker than the rest of your breast and a little bit darker than your nipples. And then your nipples shouldn't have any discharge or anything like that, no bleeding or anything. And then you're going to, will you lift your hands up over your arms for me? You're going to check this area right here as well to see if you see anything that's abnormal as well as your breast. And then for actually palpating them, you're just going to kind of go in a little circle. You just feel for lumps, and you feel for anything that's abnormal. And then for your nipples, you just kind of squeeze them to make sure that they're pliable and nothing comes out of them. And then for your axillate here, you're just going to palpate like this. Palpate for lumps, tenderness. You might feel some tenderness if you're on your menstrual cycle, and that's normal. We'll do this side. Okay, and it's also important that you do different motions with your arms and test to see the symmetric equality of them. So this, we're going to have your arms up, and then lean on something and look at them. So you're just going to inspect them that way, okay? All right, so now I'm going to inspect your heart. Your apical impulse, I'm just going to inspect it, and I don't see anything. I don't see any impulse right here in this area. And now I'm going to palpate your apical pulse, which is at your midclavicular line at the 5th intercostal space, which is about right here. Okay. All right. I feel it at about 2 centimeters in diameter. Okay. All right, now I'm going to check your radial pulse. Strong, +2. Strong, +2. And I'll check them at the same time. They're equal bilaterally. I'll check your carotid. Strong, +3. Strong, +3. And they're equal bilaterally as well. I don't see any thrills or pericordial pulsations. I'm going to feel. I don't feel any thrills. I'm sorry. Okay. So now I'm going to auscultate the heart areas on your chest, okay? Okay. I'm going to use both sides of my stethoscope. All right, so your aortic area is right here. Okay. Okay, now your pulmonic area. Now your herbs area. Okay. Now your tricuspid area. Now your mitral area. Alright, so S1 and S2 sounds were heard over all areas on both the bell and the diaphragm. Okay, now I'm going to assess your abdomen and femoral area. Your, yeah, that's fine. Okay, so your abdomen is flat, the skin is smooth, the contour is sunken, color is normal for ethnicity. I don't see any peristalsis happening with my eyes, and your umbilicus is midline, and I don't see any lesions or rashes or anything like that. Can you cough for me? Okay, I don't see any bulging or anything that would indicate a hernia or anything like that. Now I'm just going to bend down and take a deep breath for me. Good. So your either side are moving symmetrically. You don't have anything that sticks out to me. Okay, now I'm going to listen for your bowel sounds for 15 seconds on each quadrant. So I'm just going to grab my watch over here. So your bowel sounds were normal and active. Now I'm going to listen to your aortic, iliac, and femoral, which is down here, pulses to see if I can hear them. Okay, so I don't hear any bruise over those. Now I'm going to percuss your abdomen, okay? I'm going to listen for some timpani or dullness of sound. Okay. All the places sounded tympanic or dull. If it's tympanic, it means you've got gas under there. So now I'm going to percuss your liver to see where it is, and we'll be able to tell by the sound it makes when I percuss. Okay. So I'm going to start down here, and I'm going to percuss up, and then I'm going to start up here and percuss down, okay? That right there. Okay, I'm going to come up here. Come down. So right there, a little mark. Alright, so your liver is palpated at about 5.5 centimeters. Okay. So now I'm going to palpate your quadrants. I'm going to do first light and then deep, okay? And you tell me if there's any tenderness. Feel any tenderness? Alright, I didn't feel any masses or anything like that. Okay, so I'm just going to look at your legs and your arms, check for skin turgor, elasticity, anything that would indicate that you have some kind of vascular problem. So your arms look, the skin color is even and it's normal for ethnicity bilaterally. Same with the legs. Okay, no skin tears, rashes, lesions that are notable. Your skin turgor is elastic and falls back down in less than 2 seconds. Your cap refill is less than 2 seconds as well. Okay. Hair is evenly distributed over your arm, and your legs are smooth. There's no hair on your legs. Okay, so, oh, you're warm. No edema is noted. I'm going to palpate all your pulses now, starting with your carotid. Okay. So they're at +2, strong and equal bilaterally. Now I'm going to come here to your radial pulses. Radial pulses are 2+, strong and equal bilaterally. Now your brachial pulses are +2, strong and equal bilaterally. Now I'm going to palpate your femoral pulse, which is right here. 3+, strong, equal bilaterally. Now your popliteal. 2+, strong, equal bilaterally. Now your tibial. 3+, strong and equal bilaterally, and then your dorsalis pedis. And those are 2+ and strong, equal bilaterally. All right, now for this assessment, I'm going to do your musculoskeletal system. So if you'll stand up for me, I've got some socks for you, so you don't have to get on.
Do you mind tying me up in the back while I put these socks on?
Sure. Okay. Now if you'll just stand in front of me, and we're going to check your range of motions on all your joints. So just hold your hands out for me. I'm just going to look at your hands. I don't see anything. They're equal bilaterally. Can you make a fist for me? Good. Stretch them out. Good deal. They're equal bilaterally. Now I'm going to check out your wrists. I don't see anything abnormal. Equal bilaterally. You'll just kind of roll them around like that. Good, good. Now I'm going to look at your elbows. They look good. Equal bilaterally. Now just kind of do like this and out. Good deal. Now your shoulders, they are symmetric. Shrug for me like this. Good. Now we're going to come out, and we're going to go back. We're going to go here, forward, up, and then down like a clock. Any pain?
No.
Good. Now we're going to do your neck. Forward, back, side, side, and then a circle. Any pain?
No.
Okay, good deal. Now we're going to do your hips. Now, take your leg. We're going to abduct it, and then we're going to adduct it over, and then back in again. And let's go back and forward. Good. And the other one, we're going to abduct and adduct. Forward, and then back. Good. All right, so let's do the knees now. Bend them. Good, good, good. Now we're going to do our ankles. We're going to point, then flex, and then a circle. Same with the other. Point, flex, and a circle. Did you feel any pain?
No.
Good. Now we're going to do the spine. Can you do a twist for me? Okay, and now I'll twist the other way. Any pain with that? Can you do like this, this, and then now we're going to bend over, touch our toes, and then this way. Good. Okay. Now you're going to hold your arms out for me, and I'm going to push up and you push down against me. Good. Strength is equal bilaterally. Push up for me. Strength is equal bilaterally. Now I'm going to do this right here. Shrug. Okay. Good deal. Now I'm going to do your head the same way. So push for me. Good. Look that way. Okay. Look that way. Okay. Now look up. Good. So you have strong neck muscles. Okay. Now we're going to do the Romberg test. Close your eyes for me and hold your arms out, and you're going to stand there until I tell you to not stand there for 20 seconds. Okay, good. Now will you open and close your mouth for me? Okay? All right, and move it around. All right, good deal. Looks like you've got full range of motion with your jaw. Did that hurt any?
No.
Okay. Okay, so now we're gonna do this rapid movement. Can you do this? Can you do this? All right, you're gonna take your finger and put it on your nose, and you're gonna hit my finger and then go back as fast as you can. Okay? Good. All right, sorry. All right, now if you will walk from heel to toe, just like you got stopped by the police. And they're testing you for drunkenness. Okay, good. Now walk on your toes. Okay, walk on your heels for me. Okay, good. All right, so now we're going to do sensation test.
Okay.
So I'm going to have you close your eyes,
Yep.
and you're going to tell me if it. You're going to tell me where I touched you.
Okay.
Okay. All right, good. Now I'm going to do it with a sharp and a dull object. You tell me if it's sharp, if it's dull, and where I touched you. Okay.
Okay. Sharp. Sharp.
Yep.
Sharp.
Yep.
Dull.
Yep.
Dull.
Yep.
Dull.
All right, we're going to do the same thing on your hands.
Okay. Oh, close my move right.
Flip your hands over. All right, same thing, okay? Yep. Good. Now we're going to do the same thing with the sharp and dull on your hands.
Okay. Sharp. 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 Dull. Dull. Dull.
We're going to switch hands, okay? Good. Now we're switching to sharp and dull.
Sharp. 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 Dull. Dull. Dull.
All right, now we're going to go down to your feet. Can I take your socks
Yes.
off? Okay.
Got them down.
Yeah. Okay. Yep. Good. All right, sharp and dull.
Sharp. 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 Dull. Dull.
Dull. All right. Good job. Sharp and dull.
Sharp. 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 Dull. Dull. Dull.
Okay, good job. Now I'm going to ask you to close your eyes, and I'm going to put a common object in your hand, and you're going to feel around and tell me what it is. All right, hold your hands out.
Feels like a watch.
It's because it is. All right, now I'm going to draw a letter on your hand. You're going to close your eyes. You're going to tell me what I draw. I'm going to draw a number.
4.
Good job. Now I'm going to do 2-point discrimination on you. I'm going to do 2 points of touch on a part of your body, and you tell me where it is and if you can feel 2 objects touching you.
Okay.
Ready?
Right here.
Yep.
Right here.
Yep.
Right here.
Good. Okey-dokey. So now we're going to do deep tendon reflexes. So we're going to start out with the brachioradialis. Okay. Good. 2 plus. Good, 2 plus. Now we're going to do the biceps. So you're just going to relax your arm, like right here on my arm, and I'm going to tap my hand, okay?
Okay.
Good. 2 plus. And then go back here, okay? Relax. Good. You over here. Can I do the brachial?
Yeah.
Okay. All right. Good. Back here in the triceps area. Good. Okay. Now we're going to do the patellar reflex. Okay. 2 plus. 2 plus. Now we're going to do the Achilles. good. 2 plus there. 2 plus there. And the Babinski reflex.
You can do spine on that.
Okay. All right. Okay, that's negative. And that one's negative. All right, we still have to do the chart. So we'll go out here to where the chart is. You're going to put your socks on. I'm going to have you stand 20 feet away from the chart, and you're just going to read to me the lowest line that you can read.
Okay.
Okay? So cover one eye and read for me the lowest one.
DEF POTEC.
Okay, now switch.
DEF POTEC.
And then both.
DEF POTEC.
Perfect. All right, well, this concludes my assessment of Lauren. My name is Shelby. Thanks for watching.
You're blurry.
That's okay.